Hello and welcome back to this our new show. You are now watching our signature segment, See the Stories. So I know I've posted this on social media and it's been viral on social media. All the C-section mamas have joined in. So every April we celebrate Cesarean Awareness Month. Let's have a look at the details.
The month of April highlights the International Cesarean Awareness Network's efforts to promote maternal and child health. Through various campaigns and activities, the network aims to reduce unnecessary cesarean sections and encourage vaginal birth after cesarean. This globally recognized healthcare event spans April and includes initiatives such as birth planning workshops and relaxation programs to involve women in their birthing journey actively.
Now, I myself am a C-section mother, and Ranga here is a C-section father.
Yes.
So we have, very close personal stories about this, but we want to learn more because there is always more to learn in terms of, we want to know how we can better support the people that are closest to us, of course. If shall they have to get a C-section, or even what happens after a C-section? How can we support them, or does a mother be able to recover better? So to dive deeper in regards to awareness of C-section, we have now obstetrician and gynecologist Dr. Ferry Darmawan with us in the studio. Good evening, doctor.
Hi, Doc.
Good evening, Kai. Good evening, Ranga.
Yes.
Yeah,
Thanks for coming in.
Thank you for coming in. I mean, we've mentioned before that both of us are C-section parents. I'm a C-section mother.
Yes.
But I know that I've been through this, but for somebody who's currently planning their, birth journey or a new mother to be, what types of information must be given to mothers who will or might undergo cesarean delivery to prepare them mentally and emotionally?
Okay, of course, in every battle we have to know the enemy.
Yeah.
Right. But Ranga just recently updated the news about our national team.
Yes.
Before they go to another match, of course, they observe another team. It is the same to be the analogy of what the mother should see or should face when she expecting, when she's going to the birth, even vaginally or cesarean section. The more the patient or the mother know about what they gonna face, what she and the family will face, the better she will prepare for the cesarean delivery.
I see. So again, it's something that communication is key here.
Indeed. So, I think in the modern era of obstetrician and in the modern era of the health services, the patient should be able to access more information, and they should be able to access the doctors or the professional.
Right.
So every question that the patient had or the spouse had, they can get the information better. Yeah. So there's no misleading in the family during the preparation, during the waiting.
Right.
Because the pregnancy itself, I think Kai has experienced it, because the pregnancy itself is very confusing.
Yeah.
Yeah.
Very.
It's a mix of feelings. It's confusing, since also the happiness is very full there.
Right.
But also the worriness, not only from the mother, but also from the family, from the spouse also.
Of course, yeah, I can remember that about almost 7 years ago now, when we had to go back and forth just to check on the baby, right?
Yeah.
Again, the communication, the discussion. Now, how, you said it before just now, the process, So how are the consultation and the discussions should be carried out, for the expecting mother, the spouse, before they actually, decide that C-section is actually the way to go?
Okay. When the patient had actually in every pregnancy, a mother should be ready for the cesarean section. Since cesarean section can be an emergency procedures. Yeah. Because when we want to save the mother and the baby, or the mother or the baby, or both of them, in emergency cases, C-section is the answer.
Okay.
But of course, we have to be strong in indication. Like Ranga said before, we empowering to reduce the unnecessary cesarean section. Yeah, because we need the patient to know what is the real indication to do the cesarean section. Is it really is the patient really need cesarean section, or we can promote to for vaginal delivery, natural delivery. Yeah, but since every pregnancy can be a high risk pregnancy, every mother should be ready if the cesarean section is the answer of the birth procedures.
Now let me just follow up. So when can you tell? When can you now advise the expecting mom to do a C-section or a vaginal birth?
It depends on the condition of the mother, on the fetus or the baby, and also both of them. There are indications can be related to the mother. Sometimes it can be predicted from the beginning of the pregnancy.
Okay.
But sometimes we can face the problems is in the baby.
Right.
That, for example, the position of the lowest part of the baby.
Yeah. Right.
We call it the presentation. If the presentation is breech presentation in the first baby, we usually recommend to do cesarean section.
Okay.
Now, and it can be both of them. Since, for example, the baby is too big and the mother is too small, then how can we predict it? We can predict it at the end, maybe at the third 3 semesters of the pregnancy. So I think it depends on the condition of the mother and the baby.
Okay.
Yeah.
So I understand because in my journey, I knew that there was a risk that I would have a C-section because I have a comorbidity, right? So as you mentioned before, you're very right. And this is exactly the words that my doctor used. It's like we're going to war. We need to have all the information necessary. That's why, we get through, during pregnancy, we go through all these tests in the beginning, right?
Indeed.
So you would have the most information available. But I was always told from the very beginning, because I'm also a curious person, is it possible from the very beginning to do a C-section? And what scares a lot of mothers is, of course, post-C-section.
Post-cesarean
There you go.
section.
Yep.
So some mothers have the luxury of knowing that she's going to have a C-section perhaps a week before or some. But when emergency C-section happens,
Yes,
right?
indeed.
What kind of informations do you tell your patients in regards to whatever happens, be ready? But are there any specific specific things that a mother has to prepare in terms of having the possibility of having to go through a C-section?
Okay, so when a mother going to a C-section, we usually do the informed consent for the patient and the spouse. And during the informed consent procedures, we usually tell the patient what is going through the operation, through the procedures. For example, she will get what is the indication, like I said before, and then what is the procedures, how is the procedures going on. First, you will get the anesthesia. Usually, we use the spinal anesthesia for the cesarean section, and currently we have ARAX.
The ARAX system.
The ARAX system, which is more faster for recovery. And then, when we do this operation, you will feel nothing when we do the incision to you, and then we will take out the baby from the uterus, from the womb, and then we will close the abdomen, and we will repair, and there will be scar after the surgery.
Right.
The information like that, I think, should be explained to the patient, so the patient will be ready. And then it is also important to communicate about the risk for pain. As whether it is a vaginal delivery or cesarean section, there will be pain for the mothers. So being a mother is very hard.
It
Actually,
is. The process itself.
Yeah,
is
you are
very
more than
hard.
a fighter then. You're more than a fighter. There will be blood coming out from whether vaginally or in the cesarean section. There will be bleeding, and there will be a risk of infection.
Right.
And then of course, we will tell you the worst case scenario. before the procedures for the risk for complications. But complication is what we don't want to be happen, but we will tell you about the complication, such as you will have the risk for another cesarean section in the next pregnancy,
Right.
and then inside the abdomen there's another organ like urinary system, and then also the bowel system. There, we have to communicate about it. But the most important thing is we give the patient moment or with the partners, with the spouse, to discuss and then to ask questions about what they worry about it, what they concern about. We have the time and we explain it to the patient. So when you come to the operating theater, you will come with a peaceful heart.
That's really nice.
I did. I know there's a lot of stigma about women getting cesarean sections. It was very nerve-wracking, but I want to say it was a privilege for me and a luxury to be able to enjoy this birthing experience anyway, because I was ready for the C-section because I knew it was bound to happen, perhaps from the very beginning. Even though you would fight, the doctors always encouraged me, let's wait until the very end. Maybe it will be possible, but due to certain complications, it wasn't. Right, it was the only way out. So, how important is it to keep an open mind as a pregnant person? Because I feel like sometimes we have this ideal birth journey,
Right.
Yes,
right?
indeed.
And we have this ideal, birthing journey that we want.
Of course.
I know a lot of mothers are
Go
very
through,
adamant
yes.
about
Of
this.
course.
Yes, yes.
I think every woman want to be, every one of us also will want it, the pregnancy process and the birthing process is natural.
Yeah.
Yes.
Yeah. Of course, it is from God, then it is natural, it's very convenient, but we have to remember that we do cesarean section to save the mother or the baby or both of them.
Or both.
Yeah.
Right.
So please, we have the stigma that you're having a cesarean section, you're not a real mother.
I'm very sensitive
yeah?
about this. I'm sorry.
Yeah, but the real is even with the cesarean section or with the vaginal delivery, being a mother is a fighter. It's a fighting. It's a fighting. Yeah.
So, Doc, we talked about preparation and we talked about the delivery itself.
Yeah.
Now, what about support? Of course, again, we have the doctor, we have you guys. I mean, I still remember about 6 or 7 years ago coming in every month, just to check up on the baby, to check on the mother, just to make sure that both are doing fine and ready to move forward and deliver everything. But support system-wise, what your support system, the people around you can do to help the mother, of course, to go through that like Kai said,
Recovery
journey,
process.
right?
Yeah.
The process of just making sure that there's no infection around. If there is, then maybe what you can do to kind of help. Because my experience, my wife had something that it was happening for about 3 or 4 months after the C-section, because the scar was not healing properly or on time. So we had to go back and forth. So again, that's something that I had to learn on the go.
Yeah.
But for other guys that are still expecting, what can they do?
Of course, in every pregnancy and in every birthing process, Kai, Rangga, you have to have the spouse to be around you. This is the closest support system. Yeah. After your spouse, maybe the family. Okay. Both family. From I think in Indonesia we see that we are very
We're very lucky, actually.
Yes,
family.
right.
We had the
Very-
support system. Yeah.
Right.
Yeah.
But sometimes there's also misleading in the family. But sometimes there's misleading in the family. For the myth, or there's a myth that maybe your mother-in-law after the birth say that, oh, you may not eat this, you may not eat that. Yeah, sometimes it can be misleading. Then it is when the support family is very important, because being a mother when do the breastfeeding after birth is very stressful.
Yeah.
It's very tiring. It's very stressful. We need your spouse to be there. Yeah. Listen, fathers, listen. You need to be at the side of your wife. Yeah.
Good one.
Yeah. And the family should be support the mother also. So, we usually gives us the access to contact the professionals.
Right.
So when you have a misleading information, you can confirm to the doctors. Yeah, and then you can be again, we want you to enjoy the moments for being a mother. We need moments. We know that you need moment to embrace with your son, with your child, and the spouse and the family. It should be a very what is called
Enjoyable time.
moment. Indeed, Kai.
For the mother.
Yeah,
mother,
For the mother.
For the mother.
Say enjoyable, of course.
Enjoyable, of course. Yeah. And then, for now, I think the government support for not only the support system in the family, but also the government support for healthcare in Indonesia is getting better and better.
Good.
Yeah. We know that by the national insurance, BPJS, BPJS, we can every mother and every woman had the rights and had the support by the government.
Okay.
Yeah. So for now it's very easy to get information. It's very easy to get health services, and I think this is the time that being a mother should be very
Exciting.
exciting.
Yeah.
Indeed.
For me, I have a just a quick question, because a lot of people don't actually know what happens with a C-section, right?
Yeah.
And why it is so crucial to have as smooth as possible or to recover well from a C-section. I only have two questions. One, what happens during a C-section? How many? Because you have to make an incision that is layers and layers and layers, right?
Indeed.
To finally,
Reach the
see
baby.
the uterus and reach the baby. And is it possible for post C-section in the second or third the pregnancy after that to have a normal birth, and what are the criteria?
Okay, it's called the vaginal birth after cesarean. Usually we call it VBAC.
Yeah.
Vaginal birth after cesarean, VBAC or VBAC. It can be, it's not possible. It is very possible to have vaginal birth after cesarean. The concern is the complication during the birth. From the first, we have the indication we have to check the indication from the first pregnancy and the first cesarean section. For example, the first case is due to the breast presentation, and the second pregnancy is head presentation. We can do the feedback if it is possible. We will have the parameters to check and to evaluate during the process of birthing. So it is very possible. Of course, you will concern about the risk for complication. The main complication that can be done is the rupture of the uterine rupture. Uterine rupture is an emergency situation, and it dangerous for the mothers. Because it can be lethal. The rupture, it can cause bleeding and it can be lethal. So during the process, the team will observe you. Is everything going well?
Yeah.
But in vaginal birth after cesarean, if something is not going as we expected, then we will switch
To cesarean.
to cesarean very fast. We have to be able. So you need to. If you want to do the VBAC, you need to you need to have the good facility. Yeah. So when the process is not going well, you switch in the emergency situation to emergency cesarean section.
So is there a recommended gap, for instance? Because it takes a long time to recover from a C-section.
Indeed.
That's how many layers that you have to.
It's 9 layers. 9
layers.
9 layers.
People think it's easy, but no, but it's 9 layers until you finally reach the uterus, and then you pull out the baby, and then you have to repair
it,
every single layer by layer, right?
Yeah.
So how long do you to be, how long does it take? Do you have a recommended gap?
The researches for the recommended gap between the first delivery and the second delivery for the feedback is at least 18 months. 18 months. 18 months.
1.5 years.
But we also have to remember that we have the program for the first 1,000 days from the government. Yeah. So I think it will be better if you take longer.
Okay.
So you give the mothers time to recovery, and you give the mothers time to take care of the first child. Yeah. So.
And you have to give the mother time to take care of her body too.
Of course,
exactly.
of course.
Because I
Of
feel
course.
like that after C-section, your body completely changes.
Yes.
Just any pregnancy, but especially C-section, because your abdomen muscle is being torn, being slit apart, and it's literally piecing back muscle.
Yeah.
And is there any for patients like me, for instance, who had a C-section in the first pregnancy, but really hopes that a VIBAC would be possible.
Yes.
Would there be any specific recovery, I don't know, like exercise routine or something that you would really recommend for mothers who really want a VIBAC in their next pregnancy?
The most important is nutrition, yeah, for now. The most important thing in recovery is nutrition. The nutrition is important not only for the mothers but also for the babies.
Yeah.
Since the very beginning of the pregnancy, not only when you are in the third trimester,
Right.
but since the very beginning of the pregnancy,
Or even before,
the
yeah.
pregnancy, you have to be had in the very adequate nutrition. The nutrition is not only for the macronutrients, proteins, of course, fats, carbohydrates, but also in the micronutrients, yeah, like vitamins and minerals, yeah, and also ferrous. Ferrous is the basic needs for the hemoglobin, the component of the blood, yeah, the most important component of the blood. And when you do the recovery, you have to our women need a good supply of nutrition for recovery. Yeah. And then of course you need to have healthy bodies for the not
Some
only for the
exercise will help, of course.
healthy lifestyle also.
Right.
Yeah. Not only important for the vaginal birth, yeah, not only important for the cesarean section, but it is also important for the pregnancy.
Yeah, I have to agree. I was very lucky, even with my comorbidity, I've been in remission for a couple of years before I got pregnant, so
Yeah.
I could still enjoy, I had the luck of being able to enjoy most of the pregnancy.
Yeah.
But I know that a lot of mothers, and every pregnancy is different, but I know there were a lot of cases that are
Of
different.
course. Of
Be as healthy
Be as healthy as you can be.
and plan it, right, doctor?
Of course, you have
Plan
to
it.
plan the pregnancy, and it is also important to discuss with your spouse about this contraception, yeah, because if the pregnancy is too close, you cannot do feedback. You cannot do feedback. It's less than 18 months. It is not recommended to do the feedback. Yeah, so you need the contraception, of course. Even though we have the natural contraception for the breastfeeding mother, yeah, but it only save you for at least maybe only 6 months for save the natural contraception. But you need to have good contraception. As Kai said, contraception is a good planning.
Aha.
Yes.
Okay. So, Dr. Ferry, thank you so much for coming.
Thank you, Doctor.
Thank you, Kai. Thank
for
you.
covering a topic
Thanks
very
for the
close
insights.
to
Yes.
both Ranga and
Yes,
I,
yes.
and hopefully to more awareness that
Yeah.
there may be a stigma, but it is not wrong. It doesn't make you any less of a mother if you have had to go or you chose to do a C-section
Yeah.
for
Yes,
for your and your baby's safety. So happy C-section, awareness month to all the women who have gone through C-section and the dads who have supported their women through the C-section. There you go, champion right there. So yeah, so more topics to come. For the next, we're going for a short break in this hour, but see the stories will continue after the break.